This is also something that you should know coming into the consultation. Are you a good candidate for a mommy makeover? Ash, what do you think? Like, what is sort of like the top things in your mind when it comes to this question? Hi, everyone. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita, board-certified plastic surgeon in New Jersey. And I've got my co-host with me, Dr. Ashley Amalfi, up in Rochester. And
Hi,
today
guys.
Hi.
Hi.
So let's just get down to this because this is a really good episode. We're continuing our series on mommy makeovers, and we're going to be talking about who is a good candidate. So I think nobody really thinks about this. I think that's always on our radar when we're talking to you during your consultation, listening to your goals, examining you. But this is also something that you should know coming into the consultation. Are you a good candidate for a mommy makeover? Ash, what do you think? Like, what is sort of like the top things in your mind when it comes to this question as far as who's the right candidate?
There's two big things. Number one is you want to be at a really healthy period in your life. So your medical health, I think you want that really good. Your physical fitness and things like that. I think that that's really important. And then I think all the other really big category is that you want to have really realistic expectations about what a mommy makeover is and like what is it exactly that you're getting out of this, right? So you're coming to the table well, and then you understand what this is and is not about.
Yeah. I think, right, like that's so important because I think a lot of us sort of have to wrap our heads around this idea that our bodies are not going to be the same as they were before, right? And surgery has limitations. Obviously, surgery is great, that we could really make some transformative changes in people and people's confidence, but it's not perfect. There are limitations to it. And I think really understanding what those limitations are, understanding what your goals are, and really setting appropriate expectations is going to set you up for success, right? And that'll kind of make you happy and fulfilled in the decision you made to undergo surgery. But also us as surgeons, it's really important that we, are confident that, you sort of understand what these surgeries can do.
And you got to give yourself some grace, right? Like we're women, we beat ourselves up. We're like, okay, we have to hit this number on the scale or work out this many days a week. But like life is different now, right? You're probably a mom, or even if you're not, just give yourself some grace about what is attainable and what is not attainable. And then you just need to be your best self. And that looks different for everyone. And that's okay.
That looks different. Right.
Yeah. It looks different for everyone, but it also looks different for you depending on, like you said, to compare to what you were, and I always tell people, listen, I can't give you your like 20-year-old self again. Like that's not going to happen. But what we can do is we can sort of, kind of enhance or refresh or whatever it is, the body that you have now, and make that the best that it can be. There's things that we can't change, right? We can't change the quality of our skin. That changes with weight loss, pregnancies, age. We can't change the way that our fat is distributed now compared to when we were in our 20s. Like there's things that just we can't change, but we can work with it.
We make the best of what we've got. And if, as long as you and your plastic surgeon are having like that open dialogue about, okay, here's what we can do, here's what we can't do, here's what it's going to be like, is this going to meet your needs? Then that's the conversation that needs to be happening. And if you feel comfortable with that, then you are a perfect candidate for a mommy makeover because you're going to hit exactly the target that you want.
Exactly. And if you're not, that's okay too, right? Like maybe it's not the right time to have surgery. Maybe you need to kind of go back and think about it a little bit more, or come in for another consult, or even get a second opinion. But I think if there is a question in your mind or a doubt, you sort of have to sit on it and make sure that you're going into this procedure or combination of procedures like 100% understanding what it can deliver.
Yeah. Exactly. And then,
Mm-hmm.
show up as your best self, be healthy, control the things you
Mm-hmm.
can control, and
Exactly.
we will help you with where we're going.
Absolutely. All right, guys. Another great episode. Ash, I love these. So, guys, tune in. If you've missed us in the past, we've got so much great content out there. And we pretty much talk about everything, answer any question you might think of. So make sure you subscribe. But in the meantime, we're continuing our series next week, Mommy Makeover. So we'll see you then.
See you soon, guys.